Think of 6 couples in your circle. At least one of those is likely to have suffered from infertility, and in half of those cases, the man is a contributing factor. Kate and John, both 39, have suffered 3 miscarriages. Their friends seem to have no problem getting pregnant, while they are facing into a fourth round of fertility treatment, knowing that this is only a 1 in 4 chance of success for them. So how can we help Kate and John? neoMimix has developed a novel single-use device that selects an elite population of sperm, which will increase Kate and John's chances of going home with a live, healthy baby. Our innovative Class 2B medical device mimics nature's way. It does this by stimulating sperm to swim against an active fluid flow within microchannels, mimicking the way sperm naturally swim up the fallopian tubes. Compared to the closest rival product, neoMimix's preclinical data from 30 men has demonstrated a 300% increase in key sperm quality parameters. A mouse study involving the fertilization of over 900 eggs resulted in doubling of pregnancy rates. We have technically de-risked our minimal viable product, and live and beta testing is ongoing with a leading European fertility clinic group. Early results from this work is showing a clear user preference, as our solution is simpler to use and cuts sperm preparation time in half. Our device is fully recyclable and reduces plastic use in the clinic. Our team is in place. I am a reproductive biologist with 15 years experience of fertility-related research in both the university and private sectors. Our team is led by our CEO, Declan Keane, who has established his own network of fertility clinics. We have engineering and product design capability in-house, and this is backed up by an advisory board with extensive international clinical and strategic expertise. The fertility market globally is worth 23 billion and is growing at a rate of 9% year on year. Of that, the sperm selection market is 280 million, and we are ideally positioned to further diversify into the much larger embryo culture market with our microfluidics technology. We have demonstrated our technology to 12 European and US-based key opinion leaders, and their view is that there is a clear pull to the market for our solution. Following regulatory approval by month 24, our route to market is straightforward, as it comprises of mainly private fertility clinics that are readily accessible through established distribution networks. Given our differential in terms of innovation, we are confident we can dominate the market and achieve our vision of a €100 million company within 6 years. In summary, our proven technology addresses a clear unmet clinical need, it improves pregnancy rates, and has a clear user preference. And our ambitious team are looking to build partnerships with investors who think big and want to come on this journey with us. We are neoMimix.
Thank you very much, Sean. Sean, can you just maybe in the 2 minutes we have, explain a little bit more about how you can do better than the competition? Because you have mentioned there are others who are trying to do similar work.
Yeah, so Matt, the technology was developed back when IVF was developed in the late 70s and early 80s. And the current technology is a type of centrifugal method. So it spins cells down through silicon nanoparticles, and it spins them at a force of around 400 G a minute. The fastest roller coaster in the world puts a G-force on your body of about 4 to 6 G. It's a quite rudimentary technology, and our technology mimics what happens in the female reproductive tract. It's a more natural technology, and it doesn't involve centrifugation. It also facilitates automation in the clinic. The current technology is very manual, and ours is a simple 3-step process: put it on, run it, take off the sample.
If you're aiming to get to 100 million revenues in a number of years, how quickly do you need investment, and what sort of investment do you need?
Yeah, so we need investment, I suppose, now. We're ready for investment. It's a Class 2B device, so the first phase is to bring this initial product through regulatory by month 24, and then ramping up after that with that product. But we've also other products in the background in terms of embryo culture, microfluidics for embryo culture, and we have ideas there that we want to develop that. So that ambition for €100 million company isn't just for this one product, it's the bigger picture.
But is this the particular focus? Is this, as you see it, maybe your best product?
Yes, well, for sure, it's certainly, it is for now. I suppose the market is limited. I won't say limited, it's a sizable market, but there's a much bigger market in assisted reproduction that we would also target. And we need to be able to target that to to I suppose, achieve our ambition.
Okay, Sean, thank you very much for joining us today.